Part D plans are a very important part of our Medicare coverage. We're anticipating some real big changes in 2023, and I'm going to show you in this video the impact that those could have upon you financially. Now remember, when we go on Medicare, there's one of two ways in which we're going to have prescription drug coverage. Two ways. First way is if you decide to stay in original Medicare A and B, what's going to happen is you will probably add a supplemental plan to that. Most people get an F, a G, or an N supplemental plan. In addition to that, now we're going to add a Part D plan, which we call these standalone plans. Now, in most areas, we're going to have anywhere from 10 to maybe 20 different plans to choose from based upon your medications and the pharmacy that you would like to go to. Okay, so that's one way in which we can get our prescriptions covered as standalone plan. Now, the second way we do this is if we decide to get what's called a C plan or an Advantage plan. Same thing, right? And so this is when we replace original Medicare with this Advantage plan. So this is a private health insurance company that puts together a network of doctors and a schedule of copays and all those kinds of things. But that's the Advantage plan. When we do that, we will get what's called an MAPD plan, MAPD. So the Medicare Advantage portion of that coverage is for my in and outpatient care. And then we add a Part D plan, and they actually will include that or embed that. It's just all inclusive. So here it's separate, many to choose from, can be changed annually. Here it's embedded. And so what we want to do is make sure that we understand that with either system, whether it's standalone or it's embedded within the Advantage plan, we're going to have some changes for 2023. And the changes I'm going to share with you are going to apply in both of these different systems. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So in every Part D plan, that plan is going to have a structure of 4 different stages. And what this means is that we move through the stages throughout the year based upon the retail cost of our medications. All right, so we have the potential to be in 4 stages. Now, just so you know, not everyone is going to be in 4 stages. In fact, most people wouldn't even be on 2 stages, but every plan is going to have 4 potential stages. And this is why we have fluctuating copays on all Medicare plans. Our copays can go up, they can actually go down throughout the year, depending upon what stage that we're going to be in. And so every plan starts off with a deductible. That's a deductible that's established by Medicare. They set the maximum. This year, the maximum deductible for a plan that has a deductible is $485. Okay, next year, that is going to $505. So it went up about $30. Now, keep in mind, there are some plans that are actually zero deductible. There are some that may be less than the $485. This $485 just simply means it cannot be above that. Obviously, next year couldn't be above $505. So the first thing we look at is their deductible. Now, by the way, having a deductible is not a bad thing because you don't necessarily have to meet the deductible. As a matter of fact, most people or many people are not going to meet the deductible because what's going to happen is in this stage, what we're doing is we're paying a copay for our medication. And sometimes those copays are so low, they're applied to the deductible, but we never reach that. And if someone does not reach that deductible number, then they will stay in stage 1 all year long. And again, I'm just kind of speculating here, but I'd say that's probably at least half of all people do not reach their deductible when they have one. So they will stay in stage 1. But if we do reach our deductible and we've met that $505 next year, then we're going to move to stage 2. Now here, Medicare officially calls this the initial coverage stage. And basically what's going on here is we are going to pay copays. And the copays that we pay are based upon the tier of the medication. Most plans have 5 tiers. They have tier 1, 2, 3, 4, and 5. The lower the tier, the lower the copay. Or right now, your tier 1s are normally a 0 copay. Tier 2, $5. Tier 3, maybe $45. Tier 4, typically a percentage, maybe 25%. Tier 5, maybe at 45%. But the whole point is, based upon the tier of the medication, that will determine what our copay is going to be or out-of-pocket cost while we're in this stage. All right, and so that's why we tell people, as we look at drug plans, we always want to pay attention to the tiering. And one thing you really want to be careful of is sometimes a plan will change the tier of a medication. So in 2022, you may be on a medication that's rated as a tier 2. And then in 2023, they may have bumped it to a tier 4, or maybe it's a tier 3, bumped to a tier 5. And when that happens, that copay could adjust as much as $150 to $200 a month just because of a tiering change. And that's why we tell people year to year, pay attention to what the tier your medications are going to be. And so while we're in this particular stage, we're just simply paying very, very reasonable copay. So think about it. If I have a plan that is truly a zero deductible, I don't even have to worry about stage 1. I immediately go to stage 2, and all I'm going to do is I'm going to pay my copays. Okay, so here's what's going on. So while I'm in this stage getting medications, Medicare is tracking the actual retail cost of medication. Now, I could be on a medication that retails for $500, and I'm in this stage and I pay a $45 copay. Next year, I may pay a $47 copay or whatever it is. But I'm simply paying a copay, but Medicare is tracking the retail cost. So let's say I'm on Eliquis or something. That's $500 to $600 every month. Medicare is tracking the retail. I'm just paying a copay. All right. But what happens is as I get my prescriptions and that retail total is increasing every month, then that number is going up. And if that total retail number ever reaches a certain number, which is called the threshold, okay? So that threshold means in this stage, if I reach that retail threshold, and that's the key to understanding this, retail threshold, because it's certainly not your out-of-pocket cost. You paid this, the plan paid the difference, but Medicare has been tracking that. And so the retail threshold this year in 2022 is $4,430. Okay? Now keep in mind, out of your pocket, you may have spent $1,000. Okay? You didn't spend that. You paid your part and the plan paid the difference, but they've been tracking retail. So if I ever get to the threshold, this year it's $4,430. Next year, that threshold went to $4,660. So it went up a little bit, and again, that's the retail number. But if I ever reach that retail total, and again, that could take 1 month, it could take 7 months, it may be never. Let's say someone's on a medication that retails for $500 a month, and that's all they're on. So if we take 9 months, 9 times 5 is $4,500. We're getting real close to reaching that threshold. So it's 9 months, 2 months, 1 month, never. But if we ever do reach that any time in the year, that means we're now done in stage 2 and we're going to go to stage 3. Now, Medicare officially calls this the coverage gap. The layman's term, we call it the donut hole. It's been around since 2006 when these plans came about. Now, they called it the donut hole back in those days because you had zero coverage. So, donut hole, you had no help at all. So, when you were in this stage, you were truly out of pocket 100%. When they realized that was a bad idea, they began to take that number, and they've been reducing it for years now. And now we still have the donut hole, but it's gone to the lowest point it will. And what will happen here in the donut hole, we actually will pay 25% of the cost of all of our medications. So it's called coinsurance. And that's going to stay the same next year. So 25%. So you have a brand name medication that retails for $500. Here in this stage, you'll pay what? $125. You have a medication retails for $1,000, it's going to cost you $250. One that retails for $100, it's going to cost you $25. And so we pay a flat 25% coinsurance for all of our medications in this stage. Now here's what's going on though. In this stage, they're tracking a different number. Now they call this something, I don't even like the terminology, but they set the rules. They call this true out of pocket. And in this stage, and while you're in the donut hole paying the 25% coinsurance, here's what they're doing. They're tracking another number. This year, that number is $7,050. Next year, it's going to $7,400. Okay? Now, keep in mind, less than 1% of all people ever get out of the donut hole to get there. Okay? Only 5% of the entire population even get to the donut hole, period. All right? But they track this number called true out of pocket. Now, the reason I don't like that is because here it looks like that you've spent that and you have not. And here's why. They count what you spent here out of pocket, which at the most is the deductible, $505 next year. What you spend here, which is just your very reasonable copays, and which is about maybe $1,000 of that total, right? And so maybe we spent $1,500 or so out of our own pocket. And in here, here's what's happening. So they pull the number you spend here and you here, and they pull it down to here. But then also what they do is every brand name medication that you're paying in the donut hole, which by the way, generic medications don't put us in the donut hole. It's brand names that put us there. So I'm on a brand name medication. What's happening is that manufacturer must discount that medication 70%. So if that medication retails for $500, they had to discount that 70%. So that means $350 I didn't pay for it, but that $350, that 70% discount is credited inside that $7,050. So it's what you have spent out of pocket, stage 1, stage 2, your 25% coinsurance here, but also that 70% discount is in there as well. So again, that's what I'm saying. That did not come out of your pocket. In fact, maybe $2,000, $2,500 did. But again, the discount from the manufacturer was applied in there as though you paid it, though you did not. All right. So again, that's going to be a little bit higher of a threshold next year. But again, you pay copay, and we're still going to get that 70% manufacturer discount credited within the true out-of-pocket. And then last stage, and again, less than 1% of all people ever get there, and this is called the catastrophic stage. So here's the way this works. They set a copay for generics. This year is $3.95 for generics. Brand names are $9.85, okay? Or what you do in this stage is if it's greater, you pay 5% of the actual retail cost of medication. So let's say I'm on a brand name that retails for $500. Because it's higher than these basic copays, I would pay $25 for the medication. 5% of $500 is $25. Now, if the medication retailed, if this brand at retail for $100, that would only be $5. So then I would pay the greatest of the amount, either the flat copay prices or 5%, again, whatever's the largest. And the same thing is going to be true over here when we get into 2024. These copays are going to go up a little bit. If we have a generic, it's $4.15. If it's a brand name, it's $10.35. Or if 5% of the retail cost is greater, then I'll pay that 5%. Okay, so those numbers have been changing. And what I want you to realize is that no matter how we get our drugs covered, standalone drug plan, separate, or embedded within the Advantage plan, these are the numbers that we'll be looking at for 2023.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
Now, the last big change that we're seeing from 2023 has to do with insulin as well as immunizations. So right now, when people are on insulin, and that means they're taking Novolog, Humalog, Lantus, some of those quick pins type things, they typically are going to have to meet a deductible on their plan, unless the deductible is zero, but they have to meet the deductible. Then they go into that copay stage. Remember stage 2, the initial coverage. And then these insulins have been costing anywhere from about $45 to maybe $75 for that copay. But in the present system, they are counting the retail costs. So remember, this year, once I reach $4,430 in retail, which with insulin could take anywhere from maybe 4 months to 6 months. Once I've reached that, then I go into that donut hole, remember the coverage gap, and now I'm paying 25% of the cost of the retail. Okay, so that whole system I just taught you, that's the way insulin has been covered in 2022. Now, as we move forward into 2023, that's going to change because now we have an insulin reduction program that the government put together. They actually started testing it in 2021. And now we've had 5 different insulin manufacturers that have said they will participate in the program. And so if you have an insulin that you're taking that's in the program, and many of them are, what will happen is the maximum copay for you every month, and again, this is 2023 changes, will be $35 a month copay. So if you're able to get a 3-month supply, maximum copay would be $105. Now keep in mind, not every insulin is going to be in the program, and not every drug plan is going to have this model built within it. So those of you that are on insulin, it is well worth your time to make sure that you're in a plan that's going to offer you that $35 copay. And frankly, even if the premium for that plan will be a little bit higher than some, I'd rather pay a higher premium and get on my insulin at a fixed cost. And what's good about it is that $35 has nothing to do with any of the stages now. We don't worry about the deductible because it doesn't apply. We don't have to worry about the donut hole because it's not going to put us in the donut hole, nor is catastrophic an issue whatsoever. Okay, so it's a flat $35 fixed copay throughout the year as long as that insulin is within the formulary. Okay, so that's a change. Now, another change that is occurring, and that has to do with immunizations. Now, right now, what's covered in 2023 immunizations is hepatitis B, flu shots, pneumonia shots, and COVID. COVID shots as well as the COVID boosters, okay? And these are the immunizations that are covered by Medicare at zero cost to you. Now, there could be other immunizations covered, other shots that are covered, but those are typically covered through drug plans, which what? A drug plan could have a deductible with it. It could also have a copay or co-insurance for the medication. And so this is the present system. So what we're getting next year in 2023 is this. Now they're going to have for us zero copay for what they call adult immunization. So these are things that maybe people have to have boosters on, or maybe something they didn't have as a child and now they want to get. And now that adult immunization will be covered by Medicare or your Advantage plan, either way, at a zero cost to you, nothing out of your pocket, including, and here's the big deal, shingles. Okay? Now, shingle shots have been covered. They were covered over here, shingles, but you know how they were covered? They were covered through your Part D plan. And so if that Part D plan had a deductible or had a copay, then you were paying out of pocket for the shingle shot. It's a 2-round shot and can be very expensive. And so now that shingles are going to be covered at zero, either by the standalone prescription drug plan or that which is embedded within the Advantage. All right, so that's really a wonderful change for those of you that are on insulin or like to get the immunizations, including that very expensive shingle shot. So those are the changes for drug plans for 2023.